Alright, so I'm checking my environment, make sure it's safe for me, my partner, and patient. We're at the college, it appears to be okay. Mechanism of injury, not sure yet. Casualties, we have one, and assistance required none at this time. PPE, would you use gloves? Alright, so hey, I'm Jake, I'm a student paramedic, can I help you?
Yeah.
I'm gonna ask you not to move, okay?
Okay.
Alright, I'm just gonna support your neck. Did you fall and hit your head, neck, or back?
No, I sat down.
No, okay, and do you have pain in those areas?
No, just a headache.
No, alright, so why am I here today?
I have a headache.
You have a headache? Okay, so what's your name?
Elizabeth.
Elizabeth, and how old are you, Elizabeth?
18.
18. So do you know where you are today?
Yeah, in school.
Alright, I'm going to rule out C-spine because MOI is not present, and she is oriented ×3 and A on the IFU scale. Is it okay if I check your airway?
Yeah.
Okay, open. Airway is patent, no snoring or gurgling noises. Is it okay if I check your breathing now?
Yeah.
Alright, I'm just going to have to go under your shirt by your collarbone. Take a deep breath. Another. Good. Is it okay if I go under your shirt by your elbow?
Yeah.
Deep breath. Okay. And one more on this side. Alright, breathing's equal bilateral ×4. Regular and full, about 12 breaths per minute. I'm just going to check your circulation, okay? Checking carotid and radial pulse, both present, regular and full, about 70 beats per minute. I'm going to do a gross bleed check, okay? Do you have any sharp objects that are going to poke me?
No.
Okay. I'm also checking for any medical alerts, medications, or drug paraphernalia. Don't notice anything, no bleeding. So I'm going to do a neck to knees, alright? So could you look to your left and right? No tracheal deviation or JVD. Is it okay if I expose your chest to check that? Are looking for punctures, penetrating pacemakers, penetrating objects or pacemakers. Any symmetry? Could you take a breath? Another one. Symmetrical and any strenuous breathing. There was none. Is it okay if I expose your abdomen?
Yeah.
All right. Looking for discoloration, distension, or pulsating masses. None, so I'm going to palpate, checking for tenderness or rigidity. It was okay. I'm going to check your pelvis if that's all right.
Okay.
All right, checking in 3 planes. For instability or incontinence, there's none. Checking the femurs for instability, fractures, or tenderness. And then checking the ankles for any pitting edema. There was none, so I'm going to stay in play, and I would give the patient a blanket for shock treatment.
Give the flex. Give the flex.
Okay, so right now it is 7:50. We're out of scene, and I'm checking my MQP. So the environment is no hazards to me, my partner, or my patient. Mechanism of injury is uncertain right now, but my patient's sitting there. There's only one person. I don't need any assistance right now, and I have my personal protective equipment on. So hi, I'm a student paramedic. Can I help you?
Yeah.
Okay. Can you tell me what happened? Why we're here?
Just my stomach's been upset.
Okay, so you didn't fall or anything?
No.
You didn't lose consciousness at all?
No.
Is there any palpate back of your neck?
No, it's fine.
Okay, so no pain in your neck, back, or head?
No.
Okay, so can you tell me your name?
Jake.
Jake, do you know where you are?
Yeah, right at school.
Okay, do you know what time of day it is?
It's the evening.
Okay, so my patient is oriented ×3 and A on the IFU scale because he looked at me when I walked in, so alert.
Okay.
So can you open your mouth for me?
Yeah.
So you turn around. Okay, so the airway is patent, there's no obstructions. And now I'm just going to check your breathing. So I'm going to do a 4-point auscultation. I'm going to have to go under your shirt though, is that alright?
Yep.
Okay, so I'm checking midclavicular and then mid-axillary. So take a deep breath for me. Okay, another breath. Okay, go under your shirt now. Just take a deep breath for me. Alright. And another breath. Okay, so the breathing is on auscultation equal bilateral abasis to basis, and there's no abnormal breathing noises, and I'm going to estimate about 12 breaths per minute. And now I'm just going to check your circulation, okay? So I need your radial pulse and carotid. Okay, so both are present. I'm going to estimate about 60, they're just right. And their breathing and pulses are regular and full. Okay, so I'm just going to do a gross bleed check now. If you ever feel uncomfortable, just let me know. Is there any sharp objects in any of your pockets that could harm me?
No.
No? Okay. Okay, so there's no substances in fluid, no blood, and there's no medical alert bracelets. So now I'm going to do a neck to toe check, right? Okay, so can you look that way for me? Okay, and this way? So there's no JVD, no tracheal deviation, and I'm just going to check your chest, alright? So there's no scars, sign of pacemakers, patches, discoloration. And I'm just going to get you to breathe in for me, alright? Okay, and again. Okay, so there's symmetry and it's not taking a lot of effort to breathe. Now I'm just going to have to check your abdominal, right? So you said you had a sore stomach? Okay, so I'm just going to look. There's no discoloration, there's scars. Can you tell me what those are from?
Surgery.
Okay, when did that happen?
August.
Okay, so I'm just gonna, there's no pulsing masses, discoloration, just tension. I'm gonna have to palpate, right? So just let me know if it hurts. Does it hurt at all?
No.
No? Okay, just an upset stomach. So now I'm going to check your pelvis, right?
Okay.
Okay, so there's no instability, no priapism or incontinence. I'm gonna check your femur now. No instability or tenderness. No instability or tenderness. I'm just gonna check for edema now. No, there's none. And there's none. So I'm gonna give you a blanket for comfort or shock, and I'm gonna stay